University in Anaheim, and we are celebrating Children's Dental Health Month with our Smile Camp. Our students are really excited to be able to work with children today. They get to wear costumes, they get to show off what they're learning with their nutrition education, their dental education, and just have some fun with the community.
The experience that our students are getting from a community service like this is invaluable. They'll be able to remember this, reflect on this, and take it with them every step of the way into their career. We really love to take advantage of the fact that we can lower the risk level of our patients within the community by holding the Smile Camp. Students have learned about risk assessment, and then they can apply that information chairside.
Here at West Coast, I feel like they overly prepare us in the real world. There's a lot of things that we do here. What we do is provide any simple cleanings to even deep cleanings depending on their condition of oral health. And then we also provide sealants. We also do fluoride treatments and things like that.
You're able to give back to the community on something that you don't really think about. I feel like a lot of people don't really think about oral health as much. I know I didn't before I started the program, so it was really eye-opening how much you could give back. You really grow your confidence level, and you see all different types of patients. It's really nice to know how to communicate with a younger demographic. I think it's just really important to emphasize oral health at an early start, so then the patients or the community in general have better oral health in the long run. So I think it's really important to start early on, which is what we're doing here.
I feel like this school really prepares you for the real world, and having this clinic helps us prepare for that, like with seeing all kinds of patients from different backgrounds and different cultures. I feel like they really put patient care first. We want them to feel comfortable, and I feel like the professors they all come from private practice or real life experience, so they drill that into us. The patient comes first before anything else.
We just have such excitement for education and for patient interaction and for just overall health, and they get excited because they get to see the results and they get to see the impact that they can have on other people's lives.